Hello, I am Dr. Baldev Sekhon. I'm the cardiovascular surgeon and medical director of Heart Center at Trinity Health System in Steubenville, Ohio. Prior to that, I was in Cleveland. I have done over 5,000 heart surgeries and about have over 30 years of experience. In Cleveland, I have worked with University Health System as well as with Cleveland Clinic, until I was lured over here by one of my cardiology colleagues, and I've been here for the last 6 years. I love the community, I love this hospital, and I love what I'm doing. I love taking care of sick patients. Heart surgery at Trinity West Hospital covers almost 95% of the major procedures being done all over the country, including coronary artery bypass surgery, one of the most common surgery all over the world, and in communities called like open heart surgery. Other aspect of heart problem is aortic valve diseases, mitral valve diseases, aortic aneurysms, as well as pacemakers and heart failure programs. Why Trinity Health System Heart Program? Because we are part of a bigger program called Common Spirit Program, which is a nationwide organization. We have over 40 heart centers. At being a heart center, we participate in Society of Thoracic Surgery or STS database. Our results are transparent. We take the health problems relating to the heart very seriously, and in Trinity Health System, in Heart Center, we have a team approach where my cardiology colleague, heart surgeons, and other different specialties work together to achieve the best outcomes. Typically, patients is first seen by the cardiologist with symptoms of chest pain or chest heaviness, weakness. They go through stress test and then come back, get a heart catheterization done. And most of the time, if it's a minor blockage, one or two vessels, which can be fixed by cardiologist by ballooning and putting a stent in. But most of the patients who have multi-vessel blockages and are diabetic, or the main artery is blocked, which is called left main trunk stenosis, or the anatomy is such where coronaries are not amenable for angioplasty, those patients are referred for bypass operation. Now, most common question asked by the patients to the surgeon, are we going to remove the blockages? Most of the time, we don't touch the blockages. We simply bypass the blockage. We reroute the blood supply by creating different conduits to supply new blood to the heart muscle further down the blockages. Of course, anybody going through heart problem is very scary for the patient as well as for the family. We here at Trinity Health Center, we take their problems very seriously. Coronary artery bypass surgery risk is nationally about 2%. Most of the patients, now I have not, since I've been here for the last 6 years, have not lost a single patient, thank God, during surgery. Post-operatively, most of the outcomes are dependent on patient's comorbid conditions, whether coming into surgery, patient had kidney failure, or they had severe COPD, lungs are bad, or they're morbidly obese, diabetic. I tell all my patients, going through surgery, we will get you through. Main thing is stay positive, and we will be with you every step of the way during recovery phase. Now, before I talk about the different heart problems, I like to touch bases about the heart. Now, heart is a muscular organ. It beats even before the birth and until the end of the journey. The heart has two collecting chambers and two pumping chambers. On the right collecting chambers and right pumping chamber, left collecting chamber, and left pumping chamber. The blood from the rest of the body comes in the right collecting chamber and passes through a valve called tricuspid valve, and the right heart pumping chamber passes through the pulmonary artery into the lungs. With our normal breathing, blood extract oxygen from the blood, and blood gets collected in the left collecting chamber, and through the mitral valve comes into the left pumping chamber. When left pumping chamber contracts, pumps blood into the blood vessel, main blood vessel called aorta, there is a valve called aortic valve. Now, what is the function of these valves? These valves' function is they move the blood only in one direction. Once the blood, the circulation is impaired due to dysfunction of the valves, either valves are too tight or the valves are leaky, then the heart muscle gets under strain. It can thin out, its function gets diminished, and what we call congestive heart failure. I typically say the heart is more like a V8 engine, and if either due to blockages the heart muscle is so-called heart attack that becomes damaged, or due to the valve problem the heart becomes bigger, called cardiomegaly, the pump, which is V8 engine, now becomes V4 engine. That's when patients start suffering, having shortness of breath, unable to walk or do any strenuous exercise. The best cure for heart problem is prevention. Of course, that's what we like everybody to do, and I would love to go out for a community outreach program for preventive care. But once we have blockages in the coronaries, then you need coronary artery bypass surgery. And second most common procedure in the heart is aortic valve replacement. The way the aortic valve replacement is done, if the valve is too narrow, the valve doesn't open up due to degenerative changes over a period of time. So a person will have symptoms of lightheadedness, diminished exercise tolerance, or what we call syncopal attacks. So if any patient has murmur in the heart, they need to get a referral through their family doctors to the cardiologist, who will do the echocardiogram and determine the severity of the heart valve problem. Aortic valve is the most frequent. Most common is aortic stenosis, and typically we replace the aortic valve or mitral valve using either mechanical valve or bioprosthetic valves. Most common question again is, which valve is better? Is it mechanical valve is better or the tissue valve? Well, both valves have its own merits and demerits. Mechanical valve is made of special metal called pyrolytic carbon, and typically this valve will need long life anticoagulation or blood thinners in the form of coumadin or warfarin. And person has to make certain changes in their diet, which are rich in vitamin K, has to be discontinued. Typically we prescribe mechanical valves or metallic valves for patients who are younger. Anybody at the age of 50 or above now, we do recommend bioprosthetic valve. Patients who are age of 60, the bioprosthetic valves can last good 15 to 20 years. In younger patients, bioprosthetic valves may last you up to 10 years. There are two types of bioprosthetic valves which are available. One is made of pig valve or porcine valve, and cow valve or bovine valve. Porcine valves are made of pig's valve, while the bovine valves are made of a layer around the heart called pericardium. And these valves mostly needs at least 3 months of anticoagulation. After that, it's basically taking antiplatelet therapy in the form of baby aspirin. And you don't have to make any changes in your diet after 3 months. Why Trinity Health System Heart Center? We provide the best care in the area as national standards. The patient is evaluated by the cardiologist, by the cardiac surgeon, and the day of surgery, patient will meet our cardiac anesthesiologist. I have one of the best intraoperative team at Trinity West Hospital, which includes very competent cardiac anesthesiologist. As a routine, every patient gets transesophageal echocardiograms, which is standard of care. One of the best physician's assistant, as well as circulators and scrub techs. And we have very competent CRNAs, as well as very competent perfusionists from UPMC. So it's a team of about 7 to 10 people, and once the surgery is done, it is more like an orchestra. Everything done very systematically, very efficiently, and then patient is moved directly to the cardiac surgical intensive care unit, where patient is recovered. And when patient wakes up and our patient does get pre-operative teaching, it's very important for each patient going into surgery. They are given full pre-operative teaching, what to expect, as well as mentally prepared for surgery. The best outcome comes when patient is mentally prepared and knows every step of their post-operative recovery. In the intensive care unit, we have very competent, highly specialized, and compassionate intensive care nursing staff who takes care of our open heart patients. Also involved are our respiratory therapists, as well as our physiotherapists and dietitians. Typical length of stay in the after bypass surgery is about 4 to 5 days before patient is ready to go home. Most of the drainage tubes are removed after 24 to 48 hours. Patient is up and walking on the second post-operative day. And most important part of recovery is patient's pain management. And we take special efforts to make sure the patient is properly medicated so they can recover fast. After the patient is gone home, we have home health care nurse who will see them, evaluate them every day. I will see them back in the office in 2 weeks, and patients seen by their cardiologist in 2 to 4 weeks, and subsequently patient is prescribed cardiac rehab. We have one of the very robust program for the cardiac rehab at Trinity Health System. During 5 days of recovery in the hospital, not only the therapists, not only the surgeons, not only the respiratory therapists and physiotherapists play a crucial role. It's also important to take care of the medical problems. Some patients have renal failure. We have a robust nephrology program, as well as our pulmonologists who see the patient every day along with us. And we have very robust hospitalist program, highly qualified physicians who are in the hospital day and night, and who provides us very acute care anytime we need them. They're there for within a minute. So I'm very proud to be part of this team. I'm very proud to head the program, and I also would like to say that in the past, aortic valve, some of the patients I referred them for because they're either in their 80s or they're too weak or they have too many medical problems, and then the patient is referred for TAVR. TAVR stands for transcatheter valve replacement, either going through the groin or through the arm, and where we don't have to make chest bone incision and it's less invasive. But few patients qualify, they didn't want to go to Pittsburgh, and I end up operating on them. But the good news is the administration has invested significant resources to get a new team on board, Dr. Smith and Dr. Svera, who has recently joined us, and we will be developing what we call is a structural heart program, where the structural heart cardiologists as well as surgeon will evaluate patients who will benefit from TAVR or who will benefit from SAVR. SAVR means surgical aortic valve replacement. So we here in Trinity Health's program take a team approach and try to do what's best for our patient. Our motto is, what is good for our families or loved ones is good for our patient. Being a cardiovascular surgeon here is also, I take care of, treat patients with vascular problems, and a lot of patients will come to me, well, my legs hurt when I walk. Those are patients sometimes think that either they are getting old or their muscles are weak for some other reason because they feel heaviness, cramps in the legs. And most of the time it is lack of circulation to the leg muscles. Muscles cry for help because due to the blockage, there's not enough blood passing through the blockage when the muscles are working. When the person is walking or going uphill, those patients get referrals from their family doctors to the vascular surgeon, where we first try non-invasive test to evaluate, and most of those patients go through, if they have blockage, likely they also have a blockage in the neck vessels called carotid arteries, or in the pelvic bones called iliac arteries, or in the legs. And most of these blockages can be easily treated by ballooning or stenting. Once the blockage has gone beyond passing the wires through, then we do provide further services in the form of bypass operation, which is relatively complex, but most of patients do very well by bypass surgery to the legs. Even have blockage in the leg should not be ignored, because that is one sign that patient has blockages somewhere else. Those patients needs to be evaluated by ultrasound of the neck vessels. In United States, well over 750,000 strokes happen every year. Though the strokes are multifactorial, about 40% of the strokes happens due to severe blockages in the neck vessels. Once the blockage in the neck vessels are severe, more than 70%, either the clot can move up or part of the plaque can break loose and go to the brain and cause death to the brain cells and causing sometimes devastating stroke. We here at Trinity Health System, we provide services for carotid endarterectomy, which is about hour-and-a-half procedure. We remove the plaque and put a patch on it. Hospital length of stay is about 1 day to 2 days in the hospital. On national average, the risk of stroke is about 2% for this procedure. In our center, we've been below 2%, but if those patients are not treated with surgical means or by any other means, the risk of stroke is very high. So that's one of the services we provide here in Trinity Health System, along with aneurysm of the abdominal aorta. Patients who are hypertensive, obese, diabetic, smoker, or they have family history of aneurysm of the abdominal aorta needs to be screened every year with abdominal ultrasound. The abdominal aortic aneurysm is basically the ballooning of the blood vessel below the kidneys, and the blood vessel gets thin-walled, enlarged, weak, and ultimately rupture, which is fatal. Now, typically, historically, we used to do complex surgical operation by opening the abdomen, but here we can now provide these services by minimum invasive surgery, fixing the aneurysm by what we call EVAR, endovascular graft placement, going through the groin, making very small incision in the groin and positioning the graft through the blood vessel and bypassing the aneurysm, so there is no stress on the aneurysm and no chance of rupture. Once this aneurysm is fixed by EVAR, length of stay in the hospital is usually 24 to 48 hours. Patients able to walk right after surgery next day, and recovery is very fast. Patient can resume your normal activities and work after 4 to 6 weeks. But these patients need to be seen very closely by their vascular surgeon once a year, which is monitored by abdominal aortic ultrasound. The best measure of any heart center, and especially being director of heart surgery, I will say we treat one patient at a time, and I will only work here if I feel that my loved one can come and have his or her heart surgery in this hospital. And I have no hesitation, and I'm very proud of my cardiology colleagues, their competency, my operative team, their competency, as well as my ICU nursing staff and other support services, their competency. And I'm very proud to be part of this heart center. Thank you. And I take great pride to say that my support system in the office, my office staff is highly competent, very compassionate. They are the first one who talk to the family and see the patient, get them ready for me so that they can have consultation with me. They are highly compassionate, highly dedicated, as well as very competent. I'm proud of having such a capable staff with me. I will not be able to achieve what I'm achieving in this health center without all the support system I get in this place. Thank you. Healthy heart loves longer.